Dr. Colombo, thank you for taking some time to talk about this issue. First of all, what are you telling your patients who are pregnant or nursing and wanting or concerned about getting the vaccine?
Well, the first thing I'm trying to do is let them know that the vaccine is safe in pregnancy. There's a lot of misinformation out there. People are opting to delay getting the vaccine until it has more proof, they say. But in all honesty, Michigan is experienced a spike in COVID, and COVID is not safe in pregnancy. Um, Women who are pregnant aren't more likely to get COVID, but once they get it, they're more likely to get sick. And the vaccine is our best shot at protecting the mother and then subsequently protecting their baby. The other thing we're finding too is that if the mother gets the vaccine and develops antibodies, she protects her child for the first several months of life because the child gets the antibodies through the placenta and through the initial breast milk. So I'm strongly encouraging all pregnant women to get the vaccine and not wait until they've delivered or not wait till they're done breastfeeding.
Have you seen complications with pregnancies from patients who have gotten COVID?
Oh, yes. Women who are pregnant can get very, very ill. And a lot of times that'll lead to preterm delivery. It, it's not a great disease in anybody, but in pregnancy is really does have some additional wrinkles that make them more likely to get sick.
What is the top concern that you're hearing from patients who are worried about this? What is the top myth that you have to dispel?
Well, a lot of times people say, I heard this or I heard that, and they really don't have a source. It's just sort of this um, fear that's going through the community. The um, the biggest concern, I guess, that people bring up is they say it's new, but then again, the virus is new too. So of course, it's going to be a new vaccine. The technology to make this vaccine has been around for quite some time, and we've used it for other things. It's really, really clever how they made the virus so quick. They made the vaccine so quickly. When you're in obstetrics, there's expression you don't want to be the first or last person to try something, because we certainly don't always jump to a new medication if there are alternatives available. In this case, there really aren't alternatives to the COVID vaccine. Um, Once I explain to them how the vaccine works, how it makes antibodies, people feel much better about it. Previous vaccines used to, um, like, say, for the flu, they'll take the flu virus, let it grow, and then kill it, and then basically inject the dead virus into the person so the body can make antibodies. With the COVID vaccines, what they're doing is sort of tricking our body into making a portion of the COVID virus so that when the virus gets into our system, it really can't infect the cells very well. You, when a new product comes out, the first thing we look for is sort of a reason why it might be dangerous in pregnancy, some sort of biologic probability that it could be an issue. And for the COVID vaccine, there just isn't one.
I think a lot of folks, might feel I'm willing to take a risk for myself, but when it comes to my unborn child, I don't want to take this risk of this vaccine that there are still questions about.
And I get that. And certainly as obstetricians, and I'm a high risk obstetrician, the last thing I want to do is hurt a mother or an unborn child. I've devoted my life to protecting both. But a pregnant mom has to realize that the risks that her unborn child are exposed to are all maternal risks. If the mother puts herself in a bad situation, say driving in a car too quickly, that's what puts the child at risk. If the mother is exposed to the virus and gets it, she's actually putting her child at risk too. And there's just no way for a person to absolutely protect themselves from being exposed to the virus, especially because our community prevalence is so high right now.
Okay, so no hesitation on your part at all for your patients getting this vaccine.
No, if my wife was pregnant or my children were pregnant, I would strongly encourage them to get it.
Are your patients heeding your advice and getting it?
Some are. I think ultimately it comes down to a risk benefit analysis for the patient. The best thing I can do is explain to them what we know about it, the risks and the benefits, and we let them choose. I would say pretty similar to the flu virus, 50 to 60% of people are getting the vaccine. Um, I would like to see that number higher, but it's I'm not going to force somebody to get something they're not interested in. My concern is that they're making their decision based on facts rather than just I heard from this person that. Uh, that a lot of times there's a lot of misinformation. There's this stories going around that if you get the vaccine, it'll affect your future fertility. There's no reason the vaccine would do that. So once we dispel the myths, then they can make an informed decision.
All right. Dr. David Colombo, thank you very much. Appreciate it.
Oh, no problem. Thank you very much. And anyone, the high risk OB department at Spectrum Health really wants people to be safe. So if there are questions, we're available to answer them.